Imagine this. It is a quiet Sunday morning. You're drinking your coffee, and your cat jumps up onto the windowsill to watch the birds like always. But something looks off. One eye is squinted almost shut. There is a thin trail of discharge running down from the corner. And when you call their name, they turn their heads slightly away from the light, like it hurts to look at you. I know exactly how unsettling that moment is. You start Googling at 11 at night. You read forum posts written by strangers. You wonder if this is nothing or if this is the beginning of something much bigger. And here's the part that makes it worse. Eye problems in cats do not always come with a clear warning label. Sometimes it is just a little redness. Sometimes it is a slightly cloudy look you only notice under certain light. And by the time it becomes obvious, the window to fix it easily may already be closing. But what if I told you that your cat's eyes are actually one of the most honest parts of their entire body? What if I told you that vets can often spot early signs of kidney disease, high blood pressure, dental infections, and even thyroid problems just by looking closely at your cat's eyes, weeks or months before any other symptom shows up? Today, I'm going to show you exactly what to look for, what is safe to do at home, and what needs a vet's attention right away. Hi everyone. I'm Dr.
Marcus,
your neighborhood veterinarian,
and welcome back to the
channel. If you're new here, I dedicate this entire channel to helping you become the best pet parent you can possibly be. Using simple vet-approved home care and the kind of knowledge that usually only comes up during a rushed 10-minute appointment. Before we dive in, drop the guilt. You are not a bad pet parent if you didn't notice this sooner. Cats are experts at hiding discomfort. It is a survival instinct left over from their wild ancestors, who could not afford to look weak. The very fact that you are watching this video right now, taking the time to actually learn this, proves that you care more than most. I actually posted a video on reading your cat's body language for hidden pain, which I will link at the end, because it pairs perfectly with what we are covering today. So today we are doing a complete masterclass on your cat's eyes. Grab a notebook, because I am about to give you 5 things every cat owner needs to know, from the surprising early warning signs to the safe home care you can start using tonight. Let's get into it. Chapter 1. I like to call this one the mirror behind the eyes. Most owners think discharge or squinting is only ever caused by something local like dust, a scratch, or a mild infection. But here's what's truly fascinating. Your cat's retina is lined with tiny blood vessels. And those vessels are some of the most sensitive in the entire body to changes in blood pressure. When a vet shines a light into your cat's eye and sees sudden bleeding, a detached retina, or dilated pupils that do not react to light, that is very often not an eye problem at all. It is frequently a sign of hypertension, which in cats is almost always secondary to kidney disease, hyperthyroidism, or heart disease. This is not something you diagnose at home, and I want to be upfront about that right away. What you can do at home is simple observation. Once a week, in good natural light, look directly at both of your cat's pupils, side by side. They should be the same size and should shrink evenly when exposed to brighter light. If you notice one pupil is consistently larger than the other, or your cat suddenly seems to bump into furniture or misjudge jumps, please call your vet that same day. This is the kind of sign that genuinely cannot wait for a let's watch it for a week approach, because sudden blindness from hypertensive damage can sometimes be prevented if caught within hours, not days. Chapter 2. And this one might surprise you. Most people think a runny or goopy eye always means an infection needs antibiotics. But what if I told you that a huge number of mild cat eye discharges are actually caused by simple environmental irritation, and the fix might already be sitting in your bathroom? Preservative-free saline solution, the exact same kind used for contact lenses, is something most vets keep on hand and most owners have never thought to use. It is sterile. It matches the natural pH of the eye, and it gently flushes out dust, pollen, or litter dust without stinging. Here is exactly how to do it. Take a clean cotton pad, dampen it with the saline, and gently wipe from the inner corner of the eye outward, using a fresh pad for each eye so you don't cross-contaminate. Do this once if you see mild crusting or a small amount of clear discharge. Now here's a quick warning. Never use tap water, never use re-wetting eye drops meant for humans. And never use anything containing get-the-red-out ingredients like tetrahydrozoline, because these can be dangerous for cats. If the discharge is thick, yellow, green, or your cat is pawing at the eye repeatedly, that is your sign to stop the home care and call your vet. since that pattern usually points toward an actual infection or a scratch on the cornea. Chapter 3 is my personal favorite because it is so simple and so underused. It's not just a warm cloth. It's targeted vasodilation that loosens dried discharge and soothes irritated tissue without any chemicals at all. A warm compress made from a clean washcloth soaked in warm water, not hot, tested against your inner wrist first, can be held gently over a closed, crusty, or slightly swollen eye for about 2 to 3 minutes. Some owners like to steep a chamomile tea bag in warm water, let it cool to a comfortable temperature, and use the damp tea bag as the compress instead of plain water. Since chamomile has mild soothing properties that have been studied for reducing surface inflammation, I want to be very clear here. This is for the skin and fur around a closed eye only. Never squeeze tea oils or any liquid directly into your cat's open eye. The eye itself should only ever touch sterile saline or whatever your vet has prescribed. Used correctly, this compress technique is wonderful for mild puffiness after a scuffle with another cat or a bit of seasonal irritation, and it takes less than 5 minutes. Chapter 4. Let's talk about what's going on beneath the surface. Literally. Most people think diet has nothing to do with eye health, but what if I told you that omega-3 fatty acids, the same ones found in fish oil, actually play a measurable role in reducing chronic low-grade inflammation throughout your cat's body, including the delicate tissue around the eyes? Cats with consistently mild, recurring eye irritation sometimes see real improvement when their diet includes a quality omega-3 supplement formulated specifically for cats. A general starting point many vets suggest is around 20 to 55 milligrams of combined EPA and DHA per kilogram of body weight per day, mixed into food. But I promise you, the exact dose should always be confirmed with your own vet, especially if your cat is on any other medication, since fish oil can affect blood clotting at high doses. This is not a fast fix. Think of it as a slow, steady investment in your cat's overall inflammation levels. The kind of thing that pays off over 21 days or more of consistent use. Chapter 5. And this is the one I really want you to remember. Cat's eyes can also reflect dental disease. It sounds strange, I know. But the roots of your cat's upper teeth sit incredibly close to the base of the eye socket. When a tooth root abscess forms, that infection can track upward and cause swelling right below or beside the eye. Sometimes with the eye itself bulging slightly outward or watering constantly on just one side. If you notice one-sided eye watering combined with bad breath, reluctance to chew, or a small bump on the cheek below the eye, this combination is a strong signal to get a dental exam, not just an eye exam. This is one of those hidden in plain sight problems that even attentive owners miss, because we are trained to only look at the eye itself. There is one more sign I want you to tuck away because almost nobody talks about it. It's not just a darker eye. It's melanosis, a slow color change in the iris that can sometimes signal a type of eye cancer called diffuse iris melanoma. Most cats have beautifully even eye color, whether that's green, gold, or copper. If you notice a small dark patch, a freckle-like spot, or a gradual spreading darkness in one eye that was not there a few months ago, take a photo.
Nice.
Photos are actually one of the most useful tools you have, because they let your vet compare the exact same lighting and angle over time to see if a spot is truly growing or if it was always there. This is not something to panic over immediately, since many pigment spots are completely benign. But it is absolutely something to mention at your cat's next checkup and to have monitored every few months if your vet wants to keep an eye on it. Now please listen closely because this is a massive veterinary warning. Everything I have shared today is meant for mild, early-stage irritation, and for helping you notice warning signs sooner. None of these home techniques should ever be used on a cat with a visibly cloudy cornea, a sudden change in pupil size, a bulging eye, severe swelling, or any sign of pain when the eye is touched. Never give your cat any human eye medication, ever, not even gentle over-the-counter drops. Since many contain ingredients that are toxic to cats or can worsen certain conditions like glaucoma, if you ever see a sudden change, especially sudden cloudiness, or a dilated pupil that will not shrink, treat it as an emergency and call your vet or the nearest emergency animal hospital immediately. Vision loss from untreated glaucoma or hypertensive damage can become permanent within as little as 24 to 48 hours. Here is the golden rule. You do not need to use all of these at once. Daily. Simply take 10 seconds during your normal petting time to glance at both eyes and make sure they look clear, evenly sized, and comfortable. 2 to 3 times a week, if your cat tends to get mild discharge, use the saline wipe as gentle maintenance. As needed, when you notice puffiness or a bit of crustiness after a nap or a scuffle, use the warm compress for 2 to 3 minutes. The whole process should take you no more than 5 minutes total, most days. Watching for small changes in your cat's eyes is one of the hardest parts of being a pet parent, because it asks you to slow down and really look. On days when life is busy and cats are masters at pretending everything is fine, but by choosing to educate yourself, by choosing to take just a few minutes out of your day to actually look your cat in the eyes, you are proving how much you truly love them. And that makes you an incredible pet parent. If this video gave you a little more peace of mind today, please hit that like button. It genuinely helps more pet parents find this information when they need it most. Subscribe and hit the bell so you never miss our weekly deep dives. And please leave a comment telling me, has your cat ever had an eye issue that turned out to be something bigger than you expected? I read every single one. Give your sweet, beautiful cat a gentle scratch behind the ears for Dr. Marcus tonight. I'll see you in the next one.